All right, everyone, we're going to get started here. So my name is Layla. I'm on the training and support team here at Blueprint Solutions. This webinar today will give you an overview of going paperless within your Blueprint OMS software. I also wanted to note my colleague Sierra is in the chat, so if you have any questions during this presentation, feel free to put them there in the chat and she'll be able to answer them for you. So going paperless significantly cuts down your expenses across the board and obviously reduces your carbon footprint. Also, digital documents are much easier to manage and are far more secure. So let's jump into our first feature here that we're going to go over. This is going to be custom forms and letters. So your clinic can upload your own custom practice-specific forms into your Blueprint. These forms will auto-populate with patient data and are fully editable within your software. Some of these forms include those online intake forms, purchase agreements, medical report templates, marketing letters, and manufacturer forms, and many more. These forms can also be signed electronically, either on a signature pad or sent to a tablet in office to capture the patient's signature. These forms are fully customizable, and this is a great way to help build your brand for your clinic. To customize these forms, we have a feature called the template tool. On this website, you're able to create and prepare your own custom forms. This site has a catalog of free templates that you're totally welcome to use, and it also has merge fields that you're able to add into these forms to customize those forms. You are welcome to create these on your own. We can also assist in creating these forms for you, but we do charge a $40 custom form fee. To send these to us, you can submit a support ticket and attach those forms, and we will upload those into your system for you. Along with these forms, you're able to email or fax them out to patients and referring physicians. To do this, if you go into the Patient's Document tab, you can see at the very bottom there's an email or fax button there. You're able to email or fax out multiple documents at a time as well. You can see here, once you select email or fax, you can choose who it's going to, their fax number, and add a note here and a subject. It's important when faxing to check the status of the fax by going to the fax out box. To do this, if you go to the communications dropdown, you can select fax out box. Here you can track your status of your faxes. It's also important to keep an eye on your document storage. So to do this, navigate to your help dropdown and select Cloud Docs / fax usage. Here it'll track how many documents are stored in your system and also your usage within your Blueprint. Documents that are created within Blueprint use very little storage compared to documents that are scanned into Blueprint. You're totally welcome to still scan documents into Blueprint, but it's also good to note that it takes up a little bit more storage. To optimize scanning into Blueprint, we recommend that your scanning settings are set to 240 DPI for black and white and 300 for colored. The next feature we're going to cover is online forms. Online forms have been a game changer for many practices. You're able to send out those custom forms, such as those intake, paperwork, medical history, and HIPAA consent forms, directly to the patient prior to their appointment. You're also able to fill them out on a tablet within the office and send them to tablets. Upon completion of this form, the form will arrive back into Blueprint OMS automatically for you to review. With a single click, you're able to turn those forms into new patient files by skipping all of that data entry. You're also able to update existing patient files with the new information they filled out on the form. On this page, here's an example of what the patient will receive via email here on the left and how it looks when they're filling out these forms here on the right. When filling it out, the patient will receive an email and they'll verify their age and then be able to fill it out here and then click Submit in the bottom right-hand corner. The next feature we're going to touch on is Blueprint Marketing Automation here. So we offer marketing automation for sending out mass emails and print things. This can be done via email or print. Your data will be automatically queried every morning to target patients at different points in their hearing journey. And those patients can automatically receive an email from you with relevant messages that pertains to them. You are notified every morning on how many emails that were sent out, in addition to those patients who don't have emails on their file, how many letters that need to be printed. While we do have content ready for each of these campaigns, you guys have full control for customizing what are in those campaigns. This feature only takes 30 seconds to enable, and you can do this by going into your Setup menu, Marketing Automation, and selecting Enable. Here we can see a number of our campaigns. We have a combination of retention and resell. This is really great for messaging aimed at retaining and staying in contact with your current patients and targeting resale opportunities for new patients as well. Here's where we can customize what goes into these marketing emails. We can see default content is already available for all these campaigns, and it'll pull patient information such as patient name, warranty date, appointment date, and much more, but you're able to customize this however you'd like. The next thing we're going to touch on is integration with insurance clearinghouses for our U.S. customers. We offer a real-time integration with Change Healthcare, Office Ally, ClaimMD for these electronic insurance claim submission. You can submit your HCFA 1500 forms directly through Blueprint OMS, and those claims will arrive in your clearinghouse account for automatic claim submission and tracking. As seen on the screen here, you can select the Submit Electronically button at the bottom of your HCFA form. For Ontario customers, we do have an electronic billing option for WSIB through TELUS Portal. The last feature I wanted to cover today is our automated appointment reminder feature. This is another great way to stay connected with your patients automatically. Once a patient books their appointment online, they should be able to interact with the automated appointment reminder sent a few days in advance of the appointment to confirm or request rescheduling for their appointment. These are a great way to stay connected with your patients with no additional work on your part. Not to mention, appointment reminders lead to higher revenue, lower patient no-show rates, fewer unfulfilled appointments. You have a higher ability to see more patients and more time for your staff. That goes over everything that we wanted to cover today for the Going Paperless webinar. Are there any questions for anyone? For tablets, you can use any tablet as long as it has access to the internet. So you can use an iPad or an Android as long as it has access to the internet. And then for the pricing, for automated appointment reminders, it is $19 a month. And to get that enabled, all you need to do is go to your help dropdown, select Submit Support Ticket, and ask that you'd like to get that enabled, and we'll send a form over for you to fill out. For the appointment reminders, it will work. So there was a question regarding if appointment reminders only work for online booking or if it will work for ones that were booked in clinic. It will work for both. Both appointments will receive those appointment reminders. And you will have the option to choose either email or SMS. You can choose the default to go to SMS, and if they don't have a phone number on file, it'll go to email and vice versa. So you'll be able to customize that for your clinic there. Another question was regarding if there was a cost related to the fax and email option. There's no cost related to that. That is a free feature within your system. You're able to email or fax out however many documents you would like. There was another question regarding the insurance forms and how those were used. We'll go back to this page here. We just touched on our integrations in the U.S. with Change Healthcare, Office Ally, and ClaimMD, where you can submit your HCFA forms directly into those portals. To enable this integration, you'll also just need to submit a support ticket by going to that help dropdown and do some more submit support ticket, and we can get that integration set up for you. Another question was, how do you choose how the patient will receive the reminder? So you will have two different settings here. You will have a setting for unconfirmed appointments and confirmed appointments. The default is to go out 3 days before an unconfirmed appointment and 1 day before a confirmed appointment. You're able to change those defaults however you would like, but those are how it's default set up. To start using online, another question was regarding how to start using online forms. This is a completely free feature already in your system. To set it up, you just need to go into your setup menu, online forms, and then select enable. And then you'll be able to start sending out those online forms. If you would like an additional training on the online forms feature, please submit a support ticket and we can definitely get something scheduled with one of our training specialists. There was another question regarding if there's any additional trainings for the template tool. We can definitely set up a training to walk through that. That template tool, we'll open that real quick here. You can see here's what the template tool looks like, and Sierra linked it in the chat if you guys would like to access it. It's also accessible on our webpage, but you can go through these 7 steps here and look at our different types, template files. If you'd like to walk through this one-on-one with one of our training specialists, you can also submit a support ticket and just ask that you'd like to run over the template tool with one of us. Yeah, so there's also another question regarding more information on appointment reminders. So we have a user guide page that walks through these appointment reminders. This is just kind of a basic look at what these will look like. Here on the left is an email, and here on the right is a text message of what those will look like. If you have any other questions, or if you wanted to set up a phone call with one of our training specialists to go in more depth on what these look like, you can do a little bit of customizations with these, but not much. You can add a disclaimer at the bottom and things like that. But if you'd like more information, feel free to submit that support ticket, and we can also set up a time to go over that one-on-one. Another question was regarding if there is a cost with the setting up a clearinghouse and how to set this up. There is an additional cost, but this is specific to the integration. So I recommend submitting a support ticket, and we can get in contact with either Change Healthcare, ClaimMD, or Office Allied to get that information over to you. Another question was, is there any charge for one-on-one training? Absolutely not. All of our training is completely free here at Blueprint Solutions. So if you ever want any one-on-one training, feel free to submit that support ticket and we can get set up for those trainings. There was a question regarding confirming the appointments for appointment reminders. So you can see here on the screen, they'll have the option to say, yes, I'll be there, or no, I will not. And that's how they can confirm that appointment. When they confirm it, it will automatically go into your Blueprint system on your schedule and show in the confirmed status. So I wanted to touch on the emailing faxing. I'm going to go back to that page up here. So to email or fax straight from Blueprint Solutions, at the bottom of documents, you'll have this option here at the bottom that says email or fax. You can also go into the patient's document tab and select email or fax. When you do that, you'll then choose if you'd like to email or fax. For this example, you can see it was selected fax. You'll be able to enter who it's going to, their fax number, and a message here. We have default fax cover pages that will populate for you as well. And then the same goes for email. You're able to change and write out your custom email to the patient, and it'll show the document as an attachment. All of this information is also kept in the patient's journal tab, so if you ever wanted to look back and see who you email or faxed out, it will show there. Another question was regarding if they cancel an appointment automatically, does it get removed from the schedule? Yes, it will show in that canceled status for you. I can see here there's a question of what time of day do the reminders get sent out? They get sent out every day at 10 a.m. It will be in your time zone. So whatever time zone you're in, it'll go out at 10 a.m. in your time zone. We have a couple questions regarding online forms here. The first question here is, to enable appointment reminders, does that allow us to email a confirmation upon booking or just reminders? So how the appointment reminders work is, when booking the appointment, it will ask if you'd like to send out an appointment invitation to the patient. You can choose yes or no. That would be upon booking. They'll get that email or text right away, and then they will also get that reminder in addition. So they'll get the invitation and the reminder. The next question is, how do we make a new online form? So this can be created from scratch, or you can use that template tool that we covered and download that form to either Adobe or Microsoft Word and make your edits. If you need any help with creating those online forms, we do charge a $40 custom form fee, but we're welcome to help out with those. For the appointment reminders, was asked if it's billed separately or added onto your Blueprint monthly bill. That would be added onto your monthly bill. If a
Layla, are we
patient
allowed to
has
ask
no,
questions like verbally
sure,
or just
yeah,
on
that's
the
totally fine.
Okay, great. So, and that's just is that a base fee of $19 a month? And then, and like, is that for a certain number of reminders per month, or is it every month just 19, regardless of the number of reminders?
So you have unlimited reminders, so it's just going to be $19 a month for those appointment reminders for the first location. If you have additional locations, it will be $9 on top of that.
Okay, great. And I missed what you had said in response to somebody about the notifications. So say if we add create a client, they're not automatically going to get a reminder if they're put into the schedule, right? You have to click yourself that they receive a reminder.
So that's for the invitation upon booking. You can choose if you'd like to send one right away. You have customizations for event types on which event types you would like to send out reminders, so you can choose that way. But if they're scheduled for an event type, then it would go out for that event type. You're not able to say no to certain patients or yes. You can within that patient's file in their marketing section.
Okay, perfect. Thank you.
You can uncheck, yeah, you can uncheck a box to do not contact, and that won't include them in those reminders.
Gotcha.
All right, well, if there are not any further questions, we can end this webinar here. If you guys do have any questions, feel free to submit those support tickets. We're always here to help you guys out. But I really appreciate everyone's time today. I hope you enjoy the rest of your Thursday.